People think of Meridian as buildings and locations. We're not. Meridian's made up of people, about 650 individuals that are dedicated to serving folks in our community that have mental health and substance abuse issues. And what I like to say is we treat each person as an individual. When they come to us for services, we are providing the least restrictive, most effective level of care determined by a professional and the person that meets their needs and wants and desires to live a better and fuller life.
There's a lot of misconceptions about what we do and who we serve in the community, and I think one of them is that we only serve individuals without insurance, that we only serve the underserved. We really serve everyone, anyone and everyone who are in need of our services. We have individuals who come to us through different circumstances. Some are not always excited about it, but I think by the time they're finished with treatment and leave here, I think they've been cared for, respected, and set on a better path.
Our multidisciplinary team here includes clinicians, therapists, nurses, we have psychologists, psychiatrists. We have a whole team. And the one thing that I admire is that everyone is just so compassionate. They are so loyal. Folks are married to the mission and the vision of our organization. And so it's good to be in a place where it's like home away from home.
We have an umbrella of services that go from prevention and outreach, child and adult in the schools, to outpatient, medication-assisted treatment. We're involved in forensic services with the courts and mental health courts for pretrial diversion, and same thing with addictions, pretrial diversion. From there, you move on to residential services. We have a primary care clinic for the folks that we work with, and then you get into things like an addictions receiving facility, crisis stabilization. And what a lot of people don't know is we're a large housing provider for the region. It's hard to focus on recovery from mental illness or substance abuse if you don't have a place to live. So Meridian, through our interrelated corporations, New Horizons Properties, actually manages over 100 individuals in permanent supportive housing within the Gainesville and Alachua County area.
We provide MAT services, which is medication-assisted treatment for individuals that are struggling with typically opioid use disorder. We also have our primary care services. We're part of what's called integrated behavioral health. So it's looking at the whole person and integrating all of our services, medical services, into behavioral health services so that an individual can come here and they can come for therapy services, they can potentially see their outpatient psychiatrist, and then they could go down the hall and get primary care services. So they'll have their medical needs met as well.
Access to healthcare has really been a challenge. Meridian has been able to do walk-ins same day, next day, while other organizations are limited to scheduling out 3 weeks, 4 weeks, 6 weeks, or not taking new patients. Well, think about if you're in crisis and you would have to wait 3 to 6 weeks to get an appointment. Either it's going to get a lot worse or it's going to abate for a period of time but likely come back. Whereas if we can do same day, next day appointments, which we're doing now, we're serving an average on 25 to 30 people a day on walk-ins. It means we can catch them when they need us, not on our schedule, but on their schedule. And we've gotten our mobile response teams in place 24/7. So again, we're able to treat people 24/7, 365 when they're in need, not on our schedule.
Our largest hub is here in Alachua, and we also have a second hub in Lake City where we have outpatient medication-assisted treatment, residential services, and crisis stabilization. And then after that, we are actually in many more counties. We opened a location in Ocala, Palatka. We also have a location in Live Oak, Stark, McClenny. We're in 13 counties.
We do a lot to braid funding to make sure that we can serve anyone who comes through our door. Meridian never turns anybody away for the inability to pay. Now, we do ask people to pay their copay. We do ask folks to pay for services based on a sliding fee scale and other things, but we're not going to turn anybody away from treatment or care for their inability to pay. If you think about Meridian as an organization, our singular focus is to serve the community. And we take that very seriously. I think it's a noble goal, and even though we've gotten larger over time, we've done that because there's a need and a demand, and we focused on trying to meet that need and demand for the community.
We're trying to treat a lot of people, but we're also just trying to get general community awareness. If anybody is experiencing any type of mental health crisis, whether it be themselves or someone in their direct family or a friend, just please understand that this is not something that's just happening to you. It happens to everyone. Don't be afraid to reach out for help and acknowledge that there is an issue. I'm not even going to call it a problem because there's an issue in my life or an issue in someone that I love's life. I would like for you to be able to help me understand how to treat that.
We have a few events throughout the year. One is Steps to Wellness. It's a community education opportunity. We also have a walk, Miles from Meridian, every February.
We're always looking for volunteers, always looking for some really good folks who want to come alongside us and learn more about our organization and help with our footprint in different communities. You can visit mymeridianhealthcare.org. That is our official website. But you can also follow us on social media. We're on Facebook, we're on Instagram, we're also on LinkedIn.
Donations from organizations are great. Donations from family members that have been helped in services are critical. Every dollar goes to treatment. Meridian is in the community, for the community, and it takes the community to support us. That's part of our mission, that education and awareness through events, through other things, to make a difference.